from injecting kind of into the muscle and behind the muscle, and it doesn't mean that you can't. You can still inject some, but I've really gotten to just, it seems like when you just inject right to bone, it's going to warm up and spread out. You know, those are my favorite words, and it really will. It'll kind of warm up, and she'll get a natural, you know, kind of fill, and it reduces the risk of it, like having that tunneling through the muscle if you're just doing muscle. But if we don't build up this little triangle right here, we'll bring it down, and she'll continually want to, like, as she talks, moves her jaw, opens up her jaw, she's gonna get that folding of the skin in and the dimpling in. Okay, all right, so let's come and blend. So what I like to do is mix, instead of using saline, I use a lidocaine because a little bit of lidocaine never hurt anybody. And the lower face is so delicate that it's just kind of nice to have that extra, it just, you know, it just kind of feels better. So now it's nice, right? So now you basically have doubled your product, right? But it's still nice and thick. It's like, it's not a compromised product. It's actually a better product than what came from the lab. And so what I want you to do is, so then unconnect it and then just put a little bit on your hand and just kind of feel it. You want to kind of feel what that consistency is, right? Yeah. So I would say that actually is pretty good. So that's thicker than what you think it is. Like it's kind of interesting because you're like, oh wait, but what, so I want you to feel it, but what I want you to see is when you put it on your hand, it holds that structure, right? Yeah. So it's still pretty heavy,
but when I like lift it, it's still.
Yeah, it's got some nice consistency to it. So I think we keep it there. Okay. If she, like I said, if she was older, you might even say like, oh, let me put another half cc in. Like, you got to think about how heavy, because it is going to still pull in a little bit of lymph fluid. How heavy is it going to be? You don't ever want to see a line of filler. So I would fill it up all the way. Okay. Or, you know, what you could do, because you got, I think there was a little bit of maybe air, I don't know, air that switch from pushing it out. Just get a nice, solid, full vial of it. All right. Okay? Okay. All right, so let's untwist it. Make sure that the height of a patient is pretty much 90-degree angle too, because if you're up doing it, and it happens sometimes with men because they're just so freaking tall, it's a little bit, or they're down low, because what really makes them, it's like I'm watching this. The last thing I want to do is add any volume here. Even though if you would see her anywhere, you'd be like, oh, Amy, she's like a great jawline, right? But it's my job as an injector to see these little nuances and be like, okay, I have to be super careful that I'm not adding anything here, right? So just a little cleanse right here. And then we're gonna go in right where you can see where she's numb. And so the needle is kind of going right to where the marionette line is coming down. Now, what I do know, and actually we didn't end up numbing out here, what I do know is that part of this procedure is going to be to give her some length, which is perfect because I have my cannula. Also, it's important to know that this area is a little bit, you know, can be a little tender, so just be mindful of that when you're doing it. They need a break, or they need some ice, or they, you know, actually do need more lidocaine, but that's part of why I put the lidocaine in here. Is it numbs up pretty quickly too from the inside. Okay, so my goal is basically this. Yes. Right? Okay. So I'm gonna go in, just kind of slide her in. And then, okay, so I'm gonna stop injecting when I come back here. And so I'm just gonna gently, and Kayla, just tell me if this bothers you, or you wanna take a break, or you need ice, or whatever. Because you are gonna get those snaps. So I want to see and feel that catch. Do you see that catch right there? If I was in her deep fat, it would just glide. Okay. Right? But I really want to be more subdermal in this area. One, because I don't want to make her face heavy. Now, if I was doing a man, you could go much deeper. A lot of men, like if you give them a big boxy jaw, they're like, yes, you know? Yes. So you can go a little bit deeper, take it a little bit easier. But with a woman, I want the best bang for my buck, which is her not feeling heavy, but really seeing that. So I want that catch. Okay, so you're gonna see me kind of catch as I go. You see that? There's catching again. Okay, yeah, and that's exactly what she's gonna feel. That doesn't feel great. You okay? Yeah. And a little bit more, catch again. You're almost like going through these locks. Catch again. Okay, so it kind of works. Instead of just trying to push the cannula, take your hands and just kind of guide that skin back on. Okay. Okay, catch again. Okay, so now I can feel.
I can see it.
Yep. Yeah. And then what we're going to do is we're just going to go back one. We're just going to slide all the way back, but I'm watching where that is. Watching, watching. There's my tip, watching. This is not something you want to do too fast.
I love how you feel the tip with the other hand.
Yeah.
Okay.
Because do I really know where it is if I'm not watching that?
No.
Right?
Yeah.
And so I'm coming back, but I'm being super careful. And here's a great tip, is bend the needle like this. Okay? Seems odd, right? But now feel where the tip is. So before I bent it, I was thinking I was more like here. Because I couldn't, it was kind of, you know, but now I'm like, oh, okay, now, super easy. I can go to right there. Then I can take this little bit right here, rotate up, okay? And now I'm gonna come up, and because it's soft, I'm gonna be able to just kind of put a few in, you know, a little bit here. Now, this is where her nasolabial fat is. I don't wanna go up to her lip, right? So I'm gonna feel that click again. So you should feel those pops.
Yeah.
Where you're almost having to like, see, pop, right? We're in that superficial, just kind of superficial fat. With a little bit, see, you feel that catch? And then I'm gonna just put a few drops. So I'm just in this space right here. I'm just gonna come back. I'm gonna go forward, come back, little tiny drops. So I wanna get rid of that line right there. So just these little teensy tiny drops. You see that catch? You wanna be catching that skin, otherwise you're too deep. Okay, good, you're doing great, Kayla. So it's just kind of in that little area right there, that's it. I don't wanna make her chin like, you know, stick out, but I just want to bring the jawline. So think of it as less chin and more jawline.
Okay.
Right? So now I'm hoping that she's pretty well numb, but she might not be completely numb. So I'm going to say, ooh, this might be a little bit of a pinch. Okay? So it might be a little bit of pinch here, Kayla. Okay. So 3, 2, 1, poke. Yeah, still a pinch, huh?
Yeah, a little bit.
So isn't that crazy? Even with the lidocaine that we put in and the lidocaine product, she's still feeling that. But I'm hoping, even though I can't feel it myself, it's less than what it would be like if we just started there without anything. You okay, hon?
Yeah.
So now what we're gonna do is we're gonna follow that mandible, that jawline, and we're just gonna bring it out. And we're gonna do it with a cannula so it's nice and smooth. So we're gonna go in. I'm gonna rotate out, and I'm gonna keep the skin nice and tight because now I'm gonna make sure I stay superficial, and I still have got that resistance against me. And now I'm gonna hold her mentalis muscle. And we're just gonna kind of bring it around the jawline. If somebody is having a lot of pain with this, you can actually just numb up their chin.
Okay.
I like to keep I prefer not to because I can see the color. But you see how much resistance I'm getting?
Yeah.
That's normal. You doing okay, Kayla?
Yeah, doing totally good.
There you go. Okay?
Yeah.
It's a fair amount of resistance. And this is the hardest thing when you're teaching someone cannula. People be like, oh my gosh. Okay.
Yeah.
Then I'm like, okay, what do you think they do in the OR? So now what we're going to do is we're going to just be really careful. I'm just doing little bits because now I'm going into forming. I already did the support, right? So now I'm just really doing little bits because I don't want it, masculine would be from the end of the mentalis on both sides.
Correct.
So if you're doing a man, that muscle is a great marker. So just keep doing this all the way to the mentalis on both sides, then connect the pre-jaw. You'll give them such a nice square jaw. They'll love it, especially with radius. Okay, but for her, I'm really just keeping on the inside. Okay?
Yes.
So I'm just kind of going along. I'm just doing these like strips. Feeling it, making sure it's not going under her chin. You okay, Kayla?
Yeah, doing good.
And this is an area where it's not a bad idea to go right side, left side, right side, left side. You do all one side, then you go to the other side and you're like, ugh, it's not even, what do I do? You know? So just take your time. Like it shouldn't be a rush procedure. Go to the other side, do that, stand back, look, maybe take a picture, you know what I mean? Like no need to rush. There you go. So as I'm massaging, I'm also looking and seeing, okay, how are we doing? You know, right now her mentalis is supplying her chin, which means that everything that supplies her chin is getting a little bit congested in there.
Yeah.
Right? Okay. So then what I'm going to do is, instead of going deep, now I'm just going to do the superficial trick. So poke here, and we're going to just do a little bit of like just superficial play, so that we kind of give a break to all the innards. And it's almost like putting mascara on someone. You're just kind of, or eyeshadow, you know, like, okay, now I don't want to go deep. I just want to, but you can even see with the blanching with that, right?
Yeah.
I mean, she's getting, and this is what, if you ever end up doing noses, it's the same thing. Like, sometimes you have to break it up into multiple treatments, because if you have an area that's tight, there's only so much that you can do before you start to say, like, yeah, I mean, just even with how much product we have in there with the swelling, we're getting some congestion.
Yeah.
Right? Do you see that?
Yeah.
So we're gonna do the last little bit here. I'm just gonna do a little bit drop right here.
And that blanching has.
So what I'm gonna do is, now I'm gonna massage.
Okay.
So I wouldn't just like, oh, okay, well, we're done, see you later.
Okay.
It's like, okay, you've got some congestion just from the swelling putting pressure on there. So now I like to use Aquaphor only because now I'm not gonna pull on her skin, and then I'll clean it all off afterwards. Okay. But you're like, oh, okay. Oh, we need to do some massaging.
Yeah.
Yeah. Yeah.
Okay.
And I just like this too because, you know, one, I can continue to mold. I can, you know, make sure blood flow is great. I also feel like it's nice they can just kind of, like,
Wind
you know what
down
it's like
after,
when
'cause it gets you.
you're uptight. I'm uptight when I'm getting injected. It's like I act like I'm not. Well, actually, I don't. I'm like, ooh, ow. I'm such a baby.
But it is like, it kind of gets you tense
Anxious.
and a little anxious. Yeah.
Yeah. So this is just a chance just to,
Wind down.
yeah, just let them kind of come off the ceiling. You know, just let people know, like, okay, you're gonna think that you have more than what you want, especially with radius. You're gonna be more angular than you want to be. Trust me, you're gonna love it. And it's such a good product because you're not gonna end up like with a big pillow face. You're gonna have structure, you're gonna have strength. But if you have someone who's super anxious, I wouldn't do it. You won't be able to get through the 3 days. You'll have 4 hours. I'm not even joking. You'll have Instagram messages, you'll have phone calls, you'll have messenger voice, you know, because it really does, like, she might be twice the size by tonight.